January is Cervical Cancer Awareness Month, one of the most common cancer diagnoses for women. So to learn more, we turn to UofL Health and Dr. Whitney Goldsberry. Dr. Goldsberry, let's start with the symptoms. What might women be experiencing before they get diagnosed?
So some women first notice that they're having symptoms of cervical cancer when they're having excess vaginal bleeding. That could be outside of their menstrual cycle. It could be very heavy. Sometimes women do experience a lot of painful pelvic symptoms, or maybe pain with intercourse or bleeding with intercourse, and those can all be signs that you could be developing a cervical cancer.
And once you are diagnosed, let's say you have those symptoms, you go and get it checked out. Are there treatment options? What do you do then?
Yeah, absolutely. So it mostly depends on how far advanced it is. So in the earlier stages, many times we can actually get it before it evolves from a dysplasia or a precancerous lesion into an actual cancer. And with those types of interventions, we can do excisional procedures, which means removing a portion of the cervix.
Okay.
After it gets further advanced, though, we provide chemotherapy with radiation, and we work with a multidisciplinary team with our radiation oncologist at the Brown Cancer Center to provide all of those services.
Of course, ideally, it never gets that far. So let's talk about prevention, some steps that women should be considering right now, and then also maybe parents should be considering for their kids.
Yeah, so with cervical cancer awareness, it's really important that parents are aware of the HPV vaccine. So this is a vaccination that you can give to boys and girls, or women and men, from ages 9 to 45. And it can help protect against 9 different strains of HPV that can cause cervical cancer and also genital warts. And so that's a very good preventive measure from the beginning. And in addition to that, we have excellent screening tools for cervical cancer. And so with those two things combined, like Pap smears, when women get them regularly, we can actually eradicate this cancer. And so Pap smears, they vary based on the woman's age, and then also what type of screening that we're doing, whether it's just cytology, which just means the cells, or whether we're testing for HPV in addition to that.
Wow.
But it gives us an excellent insight to catch this cancer very early, and when it's just dysplasia and it hasn't actually progressed, so we can intervene and prevent the cancer from forming.
That early detection, so critical here. Thank you so much, doctor, for taking the time to come on and give us some of these insights.
Absolutely. Thank you so much for having me.
We appreciate it.